I'd like to call this meeting to order. My script says good morning. I'll edit that to good afternoon. And welcome to our Community and Health Services Committee meeting for February the 11th. Today we are anticipating a delegation on housing and an innovative project and staff from the Healthy Babies Children's Program update. We'll call on Julie Hale, Committee Clerk, to conduct a roll call.
Thank you, Chair. Regional Chair Redmond.
Present.
Councillor Craig.
Present.
Chair Erb.
Present.
Councillor Foxton.
Present.
Councillor Harris, I believe stepped out. Councillor Hunick.
Present.
Councillor Liggett. Councillor McCabe. Present. Councillor Nowak. Councillor Salonen. Present. Councillor Shantz.
Present.
Regrets from Councillor Bravanovich. Councillor Williams.
Present.
And Councillor Wolf.
Present. Right. Yep. Okay. As we begin this meeting, we are again reminded that many of our homes and places of employment in Waterloo region are situated on the land that is the traditional territory of the Haudenosaunee, the Anishinaabe, and Chinatown peoples. We recognize and deeply appreciate their historic connection to Waterloo region, and we also recognize the contributions Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise that reconciliation takes place through learning and community building with the Indigenous people who continue to live here. We are all treaty people with a responsibility to honor all our relations. Are there any conflicts of interest under the Municipal Conflict of Interest Act? There are none. We have one delegation who has not arrived as yet. And so what we will, we'll move on to the consent items on the agenda number 6, which are none. Move on to number 7.1, under Equitable Services and Opportunities, Healthy Babies, Healthy Children Program. We're going to invite Grace Birmingham and Janet McQuarrie. And Grace, I think you're going to introduce this.
Yep, great, thank you. Through you, Chair Erb. I'm the Director of Child, Family and Dental Health, and I am pleased to introduce today's presentation on the Healthy Babies, Healthy Children program. This is a long-standing public health program that plays a critical role in how we support upstream health. So I'll now invite Janet McCreary, Manager of the Healthy Babies, Healthy Children program, to highlight the work we do to support families with a baby and families expecting a baby in Waterloo region.
Good afternoon. How many of you have experienced the joy of bringing a new baby into your immediate or extended family? The joy can also be accompanied by significant challenges and stressors, especially for some families. Next slide, please. In 2024, there were 6,882 births for resident families in Waterloo region. We reached out to complete a Healthy Babies, Healthy Children screen for every one of those families with a new baby, and were successful in reaching and completing a screen for 5,072 in 2024. We see most families at the bedside while they are still in the hospital. And we make phone calls for those that we don't see in the hospital. The Healthy Babies, Healthy Children screen is a series of 36 questions that help us to determine families who may need more assistance in supporting their new baby. Next slide, please. Data since 2019 shows a marked increase in the number of babies born to families in the region. This is after a number of years where we were hovering around the 6,000 birth per year mark. You will notice the COVID baby blip in 2021, where the number of births had a bit of a big jump. It settled down a bit in 2022, but we have seen a big jump again this past year, coinciding with the increase in population for Waterloo region. The number of families we see in the Healthy Babies, Healthy Children program each year has continued to increase. Next slide, please. Healthy Babies, Healthy Children is 100% funded by the Ministry of Children, Community, and Social Services. We received notice last summer that our funding was increasing for the fiscal year 2024-2025, and we had a bit of a celebration for those much-needed funds. The program had not received an increase in funding in 12 years. We have been able to hire some additional staff, including public health nurses, registered practical nurses, and family visitors to help meet the increased demand in services. This includes bedside screening, in-home assessments, and home visiting supports for those families who need more assistance. As I know you're aware, investment in the early years through the Healthy Babies, Healthy Children program is an evidence-based, cost-effective, upstream approach that supports families with children at risk of poor growth and development outcomes. Next slide, please. So why do we want to reach these families? We know that when we invest in supporting families and children in the early years, we make a difference in minimizing and mitigating the effects of adverse childhood experiences, which can affect lifelong health. Our goal through screening at birth is to find and assist families who may need more support. These are the families who are offered home visiting with a public health nurse and a family visitor. In 2024, there were 276 families in home visiting. We walked alongside them to create goals and help get the supports they needed, including information and skill attainment related to healthy growth and development, childcare, mental health assistance, income and housing, and settlement in Canada. Next slide, please. So this is a slide that Council saw back in October, the Ipsos survey, that noted of those surveyed and who had participated in the Healthy Babies, Healthy Children program, 93% were satisfied with the services they received. Next slide, please. Our incredible staff make a difference in the lives of the Healthy Babies, Healthy Children families. We hear it throughout our service delivery when families let the staff know how meaningful their help was. For some, it has included helping a family new to Canada connect with and learn about the programs that are available to support them, especially when they have no other family or social supports. Connecting a mom who is struggling with postpartum depression to mental health services that meet her needs. Finding childcare, a crib, or a car seat. Supporting breastfeeding and transition to solid food at 6 months. Understanding the developmental stages that a child will go through and why they suddenly seem to stop sleeping. Building their confidence and skills so that they can be a good parent to their child. This is perhaps most meaningful for families who are struggling. Staff are touched when they receive personal notes from families at discharge from the program, letting them know that they made such a difference. I have an example to read to you of a letter recently received, and I have permission to share from the parent. So to my public health nurse and family visitor, I am writing this message with a heart full of gratitude. Looking back at my journey as a first-time mom in Canada, I can't help but reflect on how much of a difference your support made in my life. When I had no one, family, or close support system, you stepped in with kindness, guidance, and reassurance. To my public health nurse, your referral to the family visitor was a turning point for me. Her unwavering support, gentle words, and genuine care brought me light during a time when I felt overwhelmed and alone. She provided more than just guidance. She gave me strength, comfort, and the assurance that I was not alone in this journey. The way you both cared for my daughter and me is something I will never forget. You didn't just support me as a mother, you embraced my daughter with warmth, ensuring she had the best start in life. I consider myself incredibly lucky to have had you both during such a crucial time. From connecting me to support groups, to advising me on self-care, to simply being a phone call away when I needed encouragement, you played a role in restoring not just my mental well-being, but also in helping me embrace motherhood with confidence and joy. Because of you, my life and my family's lives have been changed for the better. Although my family visitor will no longer be visiting, I understand that many others like me need the same support I was blessed with. While it is bittersweet to see you go, I want you to know your work matters, your kindness makes a difference, and the impact you leave on families like mine is immeasurable. Thank you from the depths of my heart for everything you've done. I will always hold you in my thoughts with immense appreciation, with sincere gratitude, HBHC client. So with that, I will take any questions.
Thank you. I have one question from Councillor Fockton.
Just a comment. So how have you been doing this a long time? Not you personally, but the program's been around a long time. Yeah, because I remember when I heard my first child, and I'm not even sure you were born then, but it was wonderful. It was wonderful because you're so unsure as your first child, and you don't want to turn to your husband type thing, and the nurses are busy, so this really covered a real gap. So thank you so much. She may not think I'm the greatest mom, but I think you guys did a good job.
Next question, Councillor McCabe.
Sorry. Thank you, through you, Chair. Thanks for the presentation and the information. It is really helpful. And I remember when my daughters were born, the Healthy Babies, Healthy Child program, and they've turned out all right despite what a good job myself and my husband may be doing. But I'm just curious about, like, the 74% that are screened, it's a really high number. That's fantastic. But do you have a sense of why 26% don't get screened? Is this just, they just completely opt out of the program, or is there something more there?
So Healthy Babies, Healthy Children is a voluntary program. People do not have to participate, and so it's consent-based. We try to reach all families at bedside, but we're not there 24/7, and babies are born 24/7, and so we do reach out by phone to some families, and families are less likely to pick up the phone to respond to our attempt to contact them. So that's where we sometimes miss some families.
Okay, fair enough. I mean, excuse the pun, it's very labor-intensive work.
We
Thank you. But I also was just curious about, sorry, I couldn't resist. But I was also just curious if you could just give us a sense of how the screening and the program has changed over the years to adapt to our changing, the changing cultural nature of our community.
Well, the screen was developed in 2012. The assessment tools we use are also older, and actually they are things that we need to be looking at more carefully. We have a community of practice across Ontario of Healthy Babies, Healthy Children managers that are looking at that. But I think they really try to address the key concerns related to healthy child development for any member of our community. And we have highly skilled staff who use the screening tools and their judgment to determine families that might benefit from the program.
Great, that's really good to hear. Thank you very much, and thanks for the work that you do. Then connecting parents who need it with other services across our region.
Thank you.
Thanks very much.
Councillor Liggett.
Thank you, Mr. Chair. Could you talk a bit about the supporting the breastfeeding and transition? I want to know, I'm a great advocate. I was one of those ones who had to use a toilet cubicle to breastfeed both my children many, many years ago. With some of the lower income people who are struggling to feed their kids, I would assume that you are really advocating for the breastfeeding versus transitioning to solid foods at 6 months, for them to understand the whole nutrient thing and make sure that their children are getting those nutrients that can only come from a mother versus solid foods. So how are you working with both of those things and making sure that newcomers feel that they can also still breastfeed their children, even though they're in a new country, that they're able to do that in public?
We definitely are very much in support of breastfeeding and exclusive breastfeeding to 6 months when transition at that age. It's part of how we promote our program. It's something we talk to all families about. We encourage breastfeeding, and we work with the hospital as well to encourage breastfeeding for families at discharge from the hospital. Midwifery practices are also our partners and also encourage breastfeeding.
May I have a follow-up, please, Mr. Chair?
Go ahead.
So I guess I'm troubled by the fact that you're not talking about continuing a breastfeeding after the 6 months. It sounds like it's going on to solids and in lieu of breastfeeding. So, but surely that's not what you advocate.
Yeah, thank you for the clarification. We do advocate for breastfeeding longer than that, but the transition to solids at 6 months, but exclusive breastfeeding for the first 6 months.
Okay, thanks.
Thank you.
Chair Redmond, have you declined? Okay, thank you. All right. I see no further councillors having any questions. Thanks for your presentation. Very, very informative and helpful, and for the work that you're doing. Do you have any closing comments, Grace? No? Okay. Thank you.
Thank you.
Okay, we're going to go back to 5.1 delegations. I think our delegation has arrived, and our apologies for not being on time. There were some other issues that took a little bit more time than we anticipated. And I'd just like to remind you, Mr. Litt, that a general reminder that you conduct yourself in any of the following manners, it will result in an immediate removal from the meeting, interrupting councillors, staff, or other delegations, derogatory statements about councillors, staff, or others, turning your camera on, which is not appropriate here, hate camera or defamatory speech. And one last reminder, if you don't take any offense if there are no questions following your presentation, this is council's time to really listen and reflect upon the opinions and ideas shared with us from delegations such as yourself. So welcome. Sorry for the delay, and you have 5 minutes.
Thank you, appreciate it. I'm usually the one that's late, so it's nice for someone else to be late for a change. So my name is Stephen Litt of Vive Development. I'm often spend lots of time at council delegating, haven't been to regional council in quite some time. I'm here to present a new solution to housing. I mean, we all have major budget constraints with external versus south of the border, economic, et cetera. I think that private and public sector coming together to build housing is a great way. In this specific circumstance, there's a $25 million savings to the region over 5 years and a multiplicative effect to housing supply. So I'm going to call this a housing innovation partnership. Next slide would be great. So a little bit about our projects. You've probably seen our signs around town. We've evolved into an institutional scale mid-market rental housing developer. I'll run through the projects. The first is out King East, just past Charcoal, kind of past Hefner, Toyota. It's called the Silk Towers. The first building will be occupied in June. It's Kitchener's largest rental housing project, funded directly from the federal government through RCFI, and the second project is starting in March, so we're extremely excited about that. These are all in Kitchener, not because we like Kitchener more than any other city in the region, but just so happens that that's where our projects have ended up being. The second is right across from our office, right on the LRT at King and Ottawa Street. That project's being built in 2 phases. So it's a 29-story building with a 29-story addition off to the side to reflect sort of the absorption of rental supply in Kitchener. So we're always pushing the envelope to deliver housing in more unique forms. The third is our King and Pine project right across from St. Mary's Hospital. Again, that's funded directly through the federal government through RCFI. It is 44 stories, much bigger than the first 24-floor building that we're just about to finish. That building has innovative 3-bedroom layouts. So we've heard from council and the community that 3 bedrooms are needed. So we've listened, and we're going to try and supply that. So we deliver housing with a trifecta of affordability, energy efficiency, and accessibility. So those are our operating memorandum. So a little bit about our people on the next slide. So I'm Stephen. I grew up here in Kitchener. I love it. I have a 4-month-old and a 4-year-old son at home, so call Kitchener our home. Of all the points in the slide, the third point is really important. So in building and delivering mid-market housing, we open up more inventory in the middle of the spectrum for people to move up from deeply affordable, from people to move down from home ownership and retirement into more accessible energy efficient housing. So that's an important key metric. So in delivering lots of that good quality mid-market income, it allows there to be flow through the housing spectrum, which we simply don't have right now. We're expanded into Milton, Guelph, and St. Catharines, and generally speaking, all of our projects have 10% affordable suites by CMHC. So enough about us. So we've been watching carefully housing agendas. The region's done a great job at delivering housing over the past number of years. We own a piece of land next to 140 Weber Street. It's 0.4 acres. It's got 10 units on it. It's got a huge, gigantic rear yard. And this is a multiplicative effect. So when you take two sites and stick them together, you get more efficiency. You can build more housing, you can deliver more amenities, in this case, common areas amenities, you can build more energy efficiency, so there's this multiplicative effect. We understand that a barrier to 140 Weber being delivered and being redeveloped is that there's a very sensitive demographic of folks, residents in that community, and there seems to be a plan to respectfully relocate and accommodate their needs. And we have the resources to help that as well in our business. So our response to what we're seeing, and this is not a new idea, just to be clear. So the Housing Innovation Partnership, the region partnering with adjacent landowners, is something that was implemented in the Housing Master Plan, I believe it was called 5 years ago. So it takes some time, this has been simmering.
Apologies for interrupting, just yet 1 minute remaining.
Yep, sounds good. So I'm going to jump 2 slides ahead to sort of the nuts and bolts here. One more ahead. Thank you. One more after that. So, before you today, so the region owns 140 Weber Street. Effectively, as I mentioned, $25.8 million over 5 years is the plan to redevelop that. That takes the project, as it stands now, to 35 existing rental homes to 54. So it increases by 54%. By combining the sites together, the region saves that $25.8 million bucks. You have a private developer provide their own capital to build it. The region has that money in your coffers to deploy that on another piece of land in the region of Waterloo. In addition to us building the exact same supply that the region would supply on its own, we would build another 175 mid-market rental housing units. So you have a community that has mixed income, which just it's great for the human condition. It's great for socialization, good for upward and downward mobility in the housing spectrum. So we believe this is just an excellent project that saves the region that significant amount of capital to deploy on other projects. So I'm here for questions. Feel free to grill me. Appreciate your time.
Thank you. Councillor Hunick.
Through you, Chair Erb, to the delegation, thank you for coming today. Thank you for your philosophy. I appreciate the economic mobility and geographical mobility that you're promoting in Kitchener, and hopefully it will spread across the region as well. I heard you say a couple of times mid-market housing, and so do you offer any percentage of units that are affordable or deeply affordable?
Yes, so each project's slightly different, right, depending upon the type of funding we're getting. The one that I can speak to that we're occupying the most, so 20% of that building, so 80 units in the one out King Street East near River Road, 80 of those units are at 30% of 70% of market household income. So roughly speaking, not deeply affordable. I know that's what we all need and want. It's difficult for a private developer to get financing to build with deeply, but there's 80 units at roughly today, that's call it $1,350 for a 1-bedroom as opposed to $1,900. So we do what we can on the project here that we're talking about. Those rents would be extremely low. So those would be the ODSP level $800 rents. Yep.
Great. Thank you. Deeply affordable is not what we all need, but there are some people in our community who need that. So I appreciate that that's top of your mind, and thank you for what you're doing for our community.
Happy to help.
Councillor Foxton.
Thank you. Have you talked and worked with staff to figure out the dynamics of how we could make this work?
Yeah, we've had a lot of discussions over the past 5+ years or so. I think a framework that seems to work that's in the public domain is the Beechwood project. I know it's taken some time, but that seems to be a framework that that works, and it's worked on other projects. So open to get into some low-level specifics with staff on a go-forward basis for sure, Councillor.
Mr. Sweeney?
Yes, I noticed the comment around Beechwood and Councillor McCabe's reaction over there, so we've got some timing issues. But for all of council, I'll go back to a report that we brought forward back in December. It was the Waterloo Regional Housing Revitalization Plan, and we have put forward direction and received approval from this council to explore new partnerships and operating models specifically for the project on Weber Street. And so the plan in our work plan this year would be a public RFP that would go out to the community, and providers and partners will be in a position to be able to respond and provide us their thoughts on what the art of the possible is there.
You're done, Councillor Foxman? Yep. Chair Redmond.
Thanks so much for coming in. You're doing something that a lot of developers and companies are talking about, but you're actually doing it. What is your biggest challenge? I certainly have heard from other developers, but what's your biggest challenge in moving forward with this model?
This specific model or just general housing?
General housing.
So so CMHC changes the rules quite often. I'm going to sort of jab on it, CMHC, and I totally get that. There's so much changing the dynamic. So I would say in the past 60 days, it's been immigration, and there's just so much concern from banks about who's going to rent, where are the people coming from. We believe that there's a lot of, ingrained in existing housing stock. There's so much pent-up energy to move through it that there's plenty of demand to absorb that. So I would say construction costs are stabilized, if not coming down, which is helpful. Interest rate volatility is constantly a thing. We borrow money off of the bond market. So when stuff south of the border happens and there's tweets, the bond market's volatile and our cost of capital goes up. So just general instability. I would say immigrations are sort of the biggest concern. City Kitchener and our all the municipalities we deal with are great in approving. So I don't view that as a major barrier to entry. It's confidence in housing as a place to park investment, because in the end of the day we have to answer to the banks, right? If the banks, including the federal bank, when they give us, it's they have a third-party underwriting, and it's very rigorous. So this takes a lot of patience to put up with the ever-changing and evolving spectrum of rental development.
Thanks for coming in.
No worries.
Thanks, Mr. Litt, for your presentation.
Thank you.
Look forward to further conversations.
Thank you.
We are at item number 8, Council Committee Tracking List, which there is none. Is there any other business? The next meeting will be held on March the 4th. Now we're going to entertain a vote to go into closed session for the purpose listed on your agenda, that a closed meeting of the Administrative and Finance, Community and Health Services, and Sustainability, Infrastructure and Development Committees be held on February 11th at 1:15, I guess, in the Waterloo County Room in accordance with Section 239 of the Municipal Act 201 for the purposes of considering the following subject matters: receiving advice that is subject to the solicitor-client privilege related to personnel matters and an identifiable individual, receiving information regarding employee negotiations related to union matters, receiving financial information supplied in confidence from a third party related to tourism event, a proposed acquisition of land by the municipality, and advice subject to solicitor-client privilege relating to the property in the City of Kitchener, and receiving information that is subject to solicitor-client privilege related to the proceedings of the Ontario Land Tribunal. Is there a mover? Moved by Councillor Sullivan, seconded by Councillor McCabe. Use your e-scribe to vote for that, please. Councillor Wolf? Okay, in favor? That is carried. We will now vote to adjourn the meeting. Moved by Councillor Salen and seconded by Councillor Hiernick. Use your e-scribe to indicate your support. And that is carried.